I'm Vicki Libiakis, and welcome to Body Beautiful. This is the program where we talk with local professionals about the very latest in cosmetic procedures and medical devices. We also take your calls live on the air, and with us today we have plastic surgeon Dr. Joseph Mele. We're talking about abdominoplasty. We're going to call it tummy tucks because it's a lot easier to pronounce.
Sure.
Later we'll be taking your calls, answering any questions you have. Here's the phone number, 800-440-4884. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And before we get started, this is something we always say, but we got to say it. Any advice we give you today, certainly you're going to want a second opinion. Check with your own physician as well. Let's jump right into it. Welcome back to the program. We'd love to have you on the show.
Oh, I like being here too.
All right, tummy tucks. You know, it's not swimsuit season. There's no point in trying to stretch the topic, but I did Google just, to see what was fresh.
Sure.
And Nip and Tuck is going to be talking about it on Wednesday, and of course that's the plastic surgery show, which not so much like real life.
It's not exactly based on real life, but
No,
it's quite entertaining.
But there's also healthcare reform could include the tummy tuck tax.
Yes, as it stands right now, it does include a tummy tuck tax, or actually an elective surgery tax.
And they're also calling it the Botox.
Botox. Yeah, it covers not only surgery, but it covers all the ancillary procedures that we do, like botulinum toxins, the fillers, like Restylines, Perlines, all of those too.
And I can imagine that plastic surgeons are not particularly happy about that, or people that are hoping to
not particularly, because it's an excise tax, and it's kind of random in that it's only on women, really. I mean, it's 91% of the folks who'd be affected are women, and it's the middle class, which I thought we weren't taxing right now, but all right. So it's a little,
interesting
personal
stuff
for me.
Not necessarily a political show. Would love to examine this topic with you, but really, I think folks are going to want to know about tummy
something
tucks.
Something more upbeat.
Yeah, well, exactly.
Something more cheerful.
Who needs a tummy tuck? Really?
Tummy tucks. There's really two or groups of people that I will see who are looking for tummy tucks. The first that we usually think of are women who've had children. Especially twins seems to hurt even more. But that stretching of the belly stretches the skin. It also stretches the muscles.
So no amount
tummy
of
tuck is
sit-ups, calisthenics.
They sure help.
They help.
They sure help. I mean, having good muscle tone, I think, gives us a better result. But the problem is the case that muscle's in gets stretched, and that doesn't shrink very well. Even with exercise, it's hard to get that to shrink. Okay,
so this is part of the whole mommy makeover idea that, if your body doesn't spring back after a couple of kids.
Yeah, the mommy makers usually were working on bellies and breasts because they both take a hit with pregnancy.
Okay. Anybody else who would require a tummy tuck? Say someone lost a lot of weight.
Exactly. Yeah, the other large group of people that I will see are folks who've lost a lot of weight, because the same thing happens. The abdomen gets stretched out, and then it doesn't recoil even after the weight is lost. They certainly look better, they feel better, but there's going to be some extra skin, some redundancy there that I can get rid of for them.
This isn't liposuction. We should make this really clear. I mean, they're totally different procedures, but do you sometimes do them in conjunction with one another?
Liposuction can be a good ancillary procedure to tummy tuck, and sometimes it is an alternative. If somebody has good muscle tone, everything on that foundation is flat, and the problem is that there's just extra fat and it's disproportionate in that area, then liposuction alone can take care of it. But when the skin is loose and you do liposuction, the skin tends to get looser, and then it wrinkles more and I think looks worse, and that's where the tummy tuck comes in. Okay,
I read something about mini tummy tucks. Are you doing those these days?
Yeah, those are really a compromise between those two, between liposuction and a full tummy tuck. What a mini tummy tuck allows us to do is do liposuction on the upper part of the abdomen, and if that has a good foundation, leave it alone, and then on the lower part of the abdomen we can still tighten the skin, tighten the muscles, and that's the mini part, is we're only really tightening half of what we would do with a real big tummy tuck.
I mean, with a tummy tuck, you actually come away with like six-pack abs. I mean, how much can you actually work that muscle?
It's pretty remarkable, and we'll show some pictures in a little bit. But the thing that it really does is it tightens not only the skin so that it's smooth, but it tightens the foundation, tightens the muscles underneath. Now, the definition of those muscles, you still got to work. You still got to earn that. So I can't go in there and suddenly give someone who doesn't have good muscle tone.
Sure.
But if they have it and it's disguised because they've been pregnant or they lost weight, it appears.
All right, well, we got to take a very quick break, but we've got some photos and we've got some calls coming in. For more information about Dr. Joseph Mele, you can call him at 925-943-6353 or check him out on the web at drmele.com or on San Francisco Plastic Surgery blog.com. We'll be taking your calls and continue our talk about tummy tucks when we come back with Dr. Mele.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of Cron TV, its management, employees, or advisors.
Welcome back to Body Beautiful. We are talking with Dr. Joseph Mele about tummy tucks. We'll be taking your calls with any questions you might have. Here's the phone number, 800-440-4884. We'll also be posting the phone number for the doctor's office during and at the end of the segment. And remember, any advice we give you today, you're certainly going to want to consult your own physician as well. Doctor, we have some pictures, but before we get into that, is tummy tuck an outpatient procedure?
Technically it is, but I usually keep my patients overnight.
Okay.
So it's a 23-hour stay, just for safety and for comfort. I find patients are sore after that type of a procedure. It's a several-hour procedure. By having them there overnight, it gives me enough time to make sure they're comfortable, they're not nauseous from the anesthesia, they're ready to go home and be safe. Plus, it gives them a chance to get up. There's 2 nurses that stay with them overnight. Gives the patients a chance to get up and move and realize that they're going to be okay.
Do some people have a better bounce back?
Oh, sure. I've had some patients wake up after surgery and they're great and they really want to go home, and that's okay. As long as they meet all our criteria, they can. But most patients are happy they don't have to go anywhere right away.
Yeah. Better to be safe than sorry.
Yeah, I sleep better.
Yes.
That helps.
Yeah, we like to know that.
Yeah.
Let's go ahead and roll some of those pictures and we'll take a look.
Okay.
And we've got some before and after shots, so go ahead and...
Okay,
right.
so this is a tummy tuck in someone with a relatively small bulge at the bottom, but certainly enough to bother them, and in clothing was fairly obvious. And then afterwards we're able to smooth that out. You can see the scar extending just below. She has a very high cut underwear. You can see the scar extending to the side just below that. I did come around to the side. And I believe I did do some liposuction on the side also. We can see that fold before. It helps to smooth that out afterwards.
Okay, and let's go ahead and take a look at another one.
So same kind of deal, a little more dramatic, a lot of extra skin here and not a lot of fat. The reason that's full is the muscle's very loose. So I'm able to, through the tummy tuck, go down and tighten up the muscle, sort of put a corset on inside that holds the muscle back, and then remove all the extra skin.
Okay, so she's not holding her stomach in, that is...
She does not have to now.
Wow.
And she has a very flat stomach. Usually people have a little bit of roundness there. She happens to have a very flat stomach, though before surgery it's very difficult to discern. Okay.
May I ask, is this a result of childbearing? Or?
That was childbearing, yes. And this is more sort of massive weight loss. So someone who's gone through bypass surgery has lost more than 100 pounds, I think around 150, 175 in that range. So a lot more extra skin. And in this case, the scar is a little bit bigger. I have to go farther around. You can see it on each side of the block there in the middle. The remarkable thing beforehand, though, is behind the square is a big flap of skin that covers all her private areas. She really didn't like that. I find most women don't want a big bulge down there.
Sure.
And that can be taken care of at the same time.
And you see some muscle definition here.
Yes. Oh, she has good muscle. Right. She's a very strong woman. And I find most of my patients who've gone through that sort of massive weight loss are very strong, and they tend to recover pretty quickly.
Now, with massive weight loss, I mean, I understand that the muscles are trimmed, I guess, internally, but the skin has also been drawn back.
Yeah, I'm actually not trimming the muscle as much as just tightening the case. So the muscle, the part in the middle that contracts, very soft, it doesn't give a lot of form to the muscle. On the outside of the muscle is a case, kind of like a case on a sausage. You get the soft stuff inside. And then at each end, that case coalesces into the tendons. So for muscles on the arms, we can see the big tendons. For the abdomen, there's a tendon too, and it starts along the ribs and down in the pubic region. And I'm able to tighten that up on the inside. So I'm not actually injuring the muscle or abusing the muscle in any way, other than bringing its case together.
Okay, all right. Well, thank you for clarifying that. Sure. Also, the skin, so really, with that much weight loss, I mean, the skin could not normally be able to spring back? I mean,
if it does, I certainly don't see those patients, but the majority of the folks, it does not. And even to the point where, in that case, I was able to just go along the bottom like a normal tummy tuck. Sometimes there's so much extra skin and extends up high that I actually have to make an incision up and down in the middle, too, to bring away more skin side to side.